You're looking at a normal, healthy heart. Today, we're going to talk about atrial fibrillation and what it actually physically does to the heart so you can properly visualize and think what you're learning while you're going along. All right, so first things first, every heartbeat starts in the SA node, right up here. The SA node is the intrinsic pacemaker of the heart. It tells the heart to contract at a rate of roughly 60 to 100 beats per minute, which is why that's our normal heart rate. Okay. But in atrial fibrillation, that SA node breaks down. Okay. So instead of one of the clean signal, the atria are firing in hundreds of different disorganized rhythms. And this is what it looks like. Okay. So look up here, you see the SA node. Now look at Afib. This is what's physically going on in your heart instead of the SA node doing what it's supposed to be doing. Okay. So, what does that look like from the outside? Now, if you actually physically look at the atria, they're doing this kind of wiggle thing at the top. Okay. So, instead of physically contracting, they're just kind of wiggling. Bottom of the heart's still going, but now it's irregular because it's not getting that beat, beat. Now it's getting beats from all over the place. Okay, so that's why typically in AFib you'll have an irregular heart rate as well. All right, so what else does this AFib cause? Okay, so it's not just an irregular heartbeat. The three different things that you really are concerned about with AFib specifically are a decrease in cardiac output, because think about it, it's not really contracting like it should. Clots forming, and they typically will form in the atria right over here, okay? And then something like a stroke or even a PE, okay? So the reason why you're concerned for a stroke is because those clots that are sitting right here, if they go up into the brain or even into this pulmonary artery right here, those form pretty significant strokes and clots and PEs, okay? So just something to be careful of. Right. So remember, AFib is not just an irregular rhythm, it is a complete disruption of what the heart's supposed to be doing. So definitely something to look into. Also, while you're at it, just pay attention to the EKG down here. See, you don't really have a great P wave. So that's kind of signifying like, look, that SA node isn't beating like it should. Okay. All right. If y'all have any other questions or want any more visuals on AFib or anything else, let me know. All right.